Okay, this is Exercise Phys Lab 2. We're going to be talking about resting and exercise heart rate for this. Again, it's one of those things that really just takes a lot of practice. Luckily, you can actually do these palpation-based ones at home. Obviously not the stethoscope based measurements if you don't have a stethoscope, but you can really practice your radial and carotid pulse, especially even with somebody who's exercising at home. So I'd really just encourage you to practice as much as you possibly can. I'm going to play a couple of videos here. I'll try and manage the audio as they were shot at different times, but Brianna, our work study, did some fantastic videos on this as well a couple years ago, so I'll play those and just sort of jump in with pointers as they go along. All right.
To start, have your participant seated with his or her legs uncrossed. Palpate for the radial pulse with 2 fingers. Do not use your thumb as it has its own pulse. Count the number of beats you feel. If this is a resting measurement, count for 15 seconds and multiply your rally by 4 to get beats per minute. If during exercise, count for 10 seconds and multiply by 6 to get beats per minute.
Yeah, so it's pretty much as simple as that. Again, if you're trying to find that radial pulse, you can find your radial styloid, a little bump just proximal to the base of the thumb here, taking the pads of your 2 fingers, your index finger and your middle finger, putting them on either side of that bump, and then rolling them more medially. In, again, anatomical position would be more medially in between that bump and the flexor tendons there, and then with light pressure, super hard you'll occlude it, and too light you won't feel it, so some light pressure in between should be able to palpate for the radial pulse quite easily there. If it doesn't work, somebody might have a very, very weak pulse radially, so you can try it on their carotid or just move to a different person, and you might think, oh, my technique was off there. It was actually correct. That person just has a really light pulse. Or if you're unsure if you can find it, you can get them to do a couple of jumping jacks. Everything does get easier to palpate for as the person exercises, because their blood pressure, their systolic blood pressure, will shoot up a little bit, and their heart rate increases a little bit, so you should be able to palpate it a little bit easier with exercise. Okay, so this is using a heart rate monitor, like a strap-based heart rate monitor. Typically, if you're moving a bunch of things around and you're not just focused on a couple of baseline measures, let's say you're doing a VO2 test and you need it communicated to the computer so you can upload it and then graph things like heart rate times ventilation after the fact, you'd be using a heart rate monitor. Or sometimes you can use a heart rate monitor as a backup to a palpation. But again, you should always know how to do palpation, because sometimes the heart rate monitor will conk out and sort of stop transmitting the signal mid-test. But again, it is one of those things that we typically do use in the lab, especially when we're testing outside clients. Oh, I did not play that video. There we go.
The teaching lab is equipped with polar heart rate monitors. For a heart rate measurement, you need the black polar monitor. The unlabeled side is the side that touches the skin. You also need the elastic strap, which attaches to the monitor from the outside angle. As well as the watch. To start, wet the sides of the heart rate monitor. Make sure that you're not getting the middle wet. Then, place the monitor across the participant's body at chest height, with the monitor in the center of the chest. Using the middle button on the watch, search for EXE. This setting is for exercise. Keeping the watch on this setting will allow the monitor to pick up heart rate. Be mindful that if many people around you in the lab are using polar heart rate monitors, that signals might get crossed. Once the watch actually picks up signal from the heart rate monitor, it will switch from a time count to a heart rate measurement. Be sure that when you're done using the polar heart rate monitor, that heart rate monitors are cleaned and returned.
So yeah, it's pretty much that simple. A lot of people who have Apple Watches or things that use the photoplasmography, or they use a little green or red light to actually detect your heart rate, wrist-based, or some are even arm-based arm-based straps, they don't necessarily pick up a 2-lead ECG like the chest strap-based heart rate monitors. Chest strap will always give you the most accurate information, and people who bike, cycle, do triathlons, they'll typically wear a strap-based or a chest strap-based heart rate monitor, which transmits signal to the wrist. Again, if you're just sort of recreationally trying to track heart rate, the photoplasmography sensors on an Apple Watch or something similar will do a great job, but you can always sort of verify and use radial palpation to compare. Again, something she said in the previous one is that you only really need to do a 10-second radial palpation during exercise, and we'll see that in a second coming up here. But the reason that we would take a 10-second then multiply by 6 is there's just a lot more beats. For somebody who has a really low resting heart rate, I think mine is around 46, 48, depending. There's just not enough beats for you to average there over 10 seconds. You might be cutting out almost one full beat. So moving that up to a 15-second count at rest is a bit better. Okay, so now we are going to move on to stethoscope and carotid base measurements here, and I'll let Ian explain this one.
To start, we're going to find the carotid artery for pulse. Easiest way to do that is to find the windpipe, index, middle finger, and you're going to come beside into the little groove and press down. You don't want to push too hard, just light pressure, and you'll feel the pulse. You should be in a little groove between the muscle and the windpipe. It'd be the same count for heart rate is 15 seconds for rest, 10 seconds during exercise. The other option you can do is using a stethoscope. Not many of you probably have this. To do the stethoscope, you're basically going to come in around the third intercostal. You can go under the shirt, over the shirt, and you're going to want to make sure that you have firm pressure without using your thumb, and that the earpieces are facing out.
Sort of facing forward,
So
almost
towards
your face.
Yeah. That'll be very obviously when you get it. You want to make sure that this is on. If it's off, you can do a little quarter turn, a little tap, make sure you don't blow your ears out, but that's it.
Yeah, so just as easy as that. Typically wouldn't do carotid during exercise because you're sort of reaching up into the person's throat area. One thing with carotid is you actually have some pressure sensors in your carotid artery, which will actually release a autonomic response back, actually altering the heart rate if you take it multiple times. So that's typically one of the reasons we take it radially or brachially. But I would, again, just sort of practice it a couple of times, making sure that you can take it. Typically, people would take carotid pulses more often in a life-saving sort of situation. Stethoscope is great as well. Typically, you'd see that in more of a doctor's office setting. It's not absolutely as intrusive as reaching up to the person's neck, and might give you just a very accurate picture on what that person's heart rate is if you have one. Okay. And finally, we're going to show carotid and stethoscope heart rate measurements during exercise, and I'll do one quick video of a small example of palpation during exercise as well. So I believe I will be the one talking over this one. So you can see Ian reaching in there. Again, you don't want to reach across the person's throat to block out their airflow at all, and you don't want to be pressing too hard. This is a little awkward while the person's exercising, especially if they're sort of really sweaty, and it's almost impossible if they're wearing the headgear for a VO2 max test. Using a stethoscope, you can have them lift up their shirt while they're biking. Stethoscope would sort of work biking. It would be very hard to do running. There's just too much movement. You would hear too many sort of extraneous sounds. Typically we would do radial. So here's the last example of a different video. Brianna was doing a cycle test. I will give myself the full screen there. And we're going to fast forward. I believe she takes it right around middle of the video here. So she has a person cycling. On here, if they had a heart rate monitor on, it can communicate with a watch or the actual screen on the Monarch bikes, and this has a running timer as the person cycles, so you can see that she's looking at the timer on the screen. Again, it won't have a straight 10 seconds, so you have to do a little bit of math and keep track of it there. But you can see she just asked the person for their wrists, supported with the handlebars, palpated for that radial pulse, and then immediately had her calculation by multiplying by 6, would record that and then move on. I think there's one more towards the end here.
This value can be used to find the health benefit rating.
Asks the person for their wrist, palpates for it, can keep counting and talking to them, making sure that they feel comfortable. So she's not using the handlebars there, but she's supporting it with her other hand, so the person's not moving all over the place. So that's how to take heart rate, both resting and exercise, and at a couple different measures through radial or carotid palpation and through a stethoscope. Thanks for watching.